folks in and around the Mid-South, far beyond the Mid-South really, to get back to health for some 33 years, from musicians to star athletes to moms like myself and everyone in between. Welcome to our studio this morning, Dr. David Wootton with the Wootton Disc Clinic, the Wootton Clinic. Good morning to you.
Good morning. Good to be here, Amy.
Yeah, thanks so much for being here with us today. And you know, really and truly, I run into so many people, back, my neck, all kinds of things. Why is there such an epidemic in the U.S. with back?
If I can show you with the model,
yeah,
that'd be great. And by the way, I'm excited to be here, Amy.
Yeah, thank you so much. We appreciate it.
So, and for those of your viewers who are not recording you already on this awesome show, they need to record this. I'm going to show them something about back pain that they've probably never seen or heard before.
Very good.
So what happens with the spine is a very hard tissue. It's a bone, multiple bones, and that's what supports your upper body weight.
All right.
And they sit on two joints here in the lower back called SI joints or sacroiliac joints. And a spine that's positioned like that is a healthy spine, no pain.
Okay.
What happens oftentimes when patients or people do a lot of bending and lifting is they cause misalignments in the SI joint that causes the pelvis to do this. Now, there are other things that can cause back pain, fractures, tumors, kidney and bladder issues. But once you've eliminated those and you've determined that it's actually this particular misalignment, which is what most back pain issues come from.
I have that.
Okay.
Yeah.
When the pelvis is misaligned this way, what that does is it puts extra strain on the muscles. The muscles are like a rope on a tent pole, and they hold that spine up and erect. So when that spine is not in a position to support properly, those muscles get overworked, and then they go into their doctor and he says, you have strained a muscle in your back.
Yeah.
Or if they say, if a patient comes in and says, my back keeps going out of place or giving out on me. What's happening is those SI joints being misaligned become weakened, and they'll slip and come further out of place, and now you're down for 2 weeks with bad back pain.
Ooh, it can cause problems. Now, I know that this is something that you deal with a lot, but you have a special and unique way, and I've actually been on it, decompression thing. That, I mean, it looks just like a big machine to me, but wow, does it bring relief.
Yeah.
Tell us about that.
Well, what happens when this misalignment I just demonstrated stays there for a long period of time, it increases the pressure on the discs in the lower back and ultimately causes that disc to degenerate and come out of place.
Right.
And they call that a bulging disc or herniated or ruptured disc. And so that looks just like this, Amy. When that disc begins to thin down, it begins to push out of place, and it does that. And that puts pressure on the nerve, and now we get pain down the leg, sciatica, we get numbness in the foot, and so on. And that's just not a good condition. So
I want to show that because this is interesting. Is this the nerve here?
That's the nerve.
Okay, see what happens here. See, watch for the red thing, okay? There it is. That's what's causing the pain if you have something like that, right? Because it's hitting the nerve.
Correct.
So what is the decompression thing do?
Spinal decompression is the best thing since sliced bread for disc problems like this. So it's invented by an anesthesiologist, Dr. Alan Dyer, and the way that it works is there's a belt that goes around the waist, the patient lays on their back, and the table pulls with a very gentle pull called a logarithmic pull.
Okay.
And what that is, it's a pull that decelerates. It slows down as it pulls firmer up until it reaches the poundage that we set the table at. And the table cycles back and forth 18 times over a 30-minute period. So it's actually milking that disc, gradually pulling that disc back in place. It's the best thing.
Oh, I've gotten it done, and let me just tell you, it is amazing. It is truly amazing. So can people get in and get on this table? What do they need to do to make it happen?
Well, if they call the office, if they call the office, we'll come in and evaluate, and we'll eliminate those other things I talked about that can cause back pain. But if they're a candidate for it, we'll lay out the program for them, and we'll get to busy working. And it's a daily process for about a month. And usually within a week they're better, and 10 days later they're a lot better, and by the end of the month we hope we've kept them off an operating table.
And I've talked to dozens of people who've been to you, including one lady yesterday, and said she couldn't move her arms, she had numbness, and she's completely moving around now.
Awesome.
So make that call right now. Let's pop up that full screen again. Dr. Wootton, thank you so much for joining us. Right now it's located at 7730 Wolf River Boulevard, Suite 112. You can talk to Robin, is that right?
Call Robin.
Robin's waiting, 901-756-2424, and we do appreciate it. Trust me, I've gotten it done, and I am walking and moving around today thanks to it. Thank you very much. Good to see you. Coming up is one of your New Year's resolutions to get in better shape. You got to have a good back to do it. So find out how you can do it. Make an appointment with Dr. Wootton, and then check in with Planet Fitness. We'll show you how you can reach your goals. Up next.